Nigeria is on high alert to check the spread of COVID-19 with the discovery of 3 cases of the Omicron variant of the virus by the Nigeria Center for Disease Control. Now, the world greeted the new variant with fear and travel restrictions, especially as it is said to be more transmissible than other existing variants of the disease. The NCDC assumes Omicron is widespread globally, given the increasing number of countries reporting this variant. On the latest statistics on infections from the NCDC, Nigeria recorded 47 new cases of COVID-19, with Plateau State recording the highest daily toll with 16 new cases, followed by the Federal Capital Territory and Rivers State with 8 cases each. So far, Nigeria has reported 214,317 confirmed cases of COVID-19, with 207,357 discharged and 2,978 deaths. Well, joining me via Zoom from Kano is public health physician Dr. Usman Bashir. Good morning, Dr. Bashir. Thank you for joining us on TVC Breakfast.
Thank you for having me. Good morning, everyone.
Right. Just when we're trying to deal with the Delta, the Alpha, and the various variants that we have seen between last year and now with regards to the COVID-19, we are now being hit by Omicron, which is said to be in 23 countries, and Nigeria has discovered 3. It is also being reported that perhaps this is highly contagious because of the spread. Talk to us. What could be the consequences? What are the concerns you have with this virus?
Good morning, everyone. Like we all know, viruses tend to mutate when they are allowed unabated. So, like in our own case, we all know that these variants are expected due to the fact that there is a low level of vaccine coverage, especially in African countries, and the need for, like, currently I think about only 3% of the expected number of eligible people that are supposed to be vaccinated are vaccinated currently, which is far away from the target of about 40% by December this year, as indicated by MPHC. So, and then these variants, we are still studying them, even though it has almost twice the number of mutations as that of Delta, which will also create a sense of anxiety and fears that we don't know the level of transmissibility, whether it causes more severe illnesses, even though some studies that are being done now are showing that the risk of severe infection is still not that high as expected. And then there is need for countries to strengthen their surveillance system so that we could be able to find even other cases. And then also whether it's effective now in the current vaccines. We need to also plan this to be done, because our major weapon now is the vaccination, which will help in getting the required immunity. But we need to do more, especially in vaccine coverage and even vaccine hesitance, because we need to come out and get these vaccines. Now the vaccines are available in the country.
As much as we need to do more in several areas that you have mentioned, which we'll still talk about or expatiate on as we continue this conversation, the concern again is the effect this virus will have on the course of the pandemic, because a lot of countries had opened up and felt that we can return, try to contain the virus and return to normal business activities. But we are beginning to see travel restrictions. We are beginning to see so many things happening. What do you think the effect might be on the course of the pandemic?
I guess these border closures, travel restrictions are more of out of fear, because already, like I said, it's because like countries like South Africa they have a very good and robust surveillance system, courtesy of their HIV and TB pandemic, which also enable them to to pick these cases. So it's already studies are being done. So many variants are being found. So, but the fear is that this Omicron, like we mentioned now, it has almost 30 mutations in spike protein, which is what enables the virus to get into the body. So that is the major fear. And then travel restrictions might not be the problem, because it will still affect so many economies. And then there is need for us to up our surveillance system. That is the major. And then also increase vaccine coverage, so that countries that don't have that have low vaccine coverage should be given more leverage or opportunities to conduct their vaccine. And then people should still observe those protocols, because as you can see now, people have gone back to normal. They don't wear their face masks. They engage in gathering, especially now holiday is coming. So we need to be very wary. People need to really, if they don't need to travel, they should stay where they are. If there's those that need to travel should observe those protocols. People should be tested, and they should make sure that they are fully vaccinated. Even though now, like I said, we are not sure whether the vaccine will be effective or not on this variant, but additional studies are so there are some promising studies that showing that.
With the uncertainty of the efficacy of the vaccine on Omicron, where does that leave us? Because the concern for persons, we've seen some countries where they have taken even booster vaccines, and we already know that there is vaccine hesitancy. Will we have to start asking people to take more vaccines or vaccination? Where does this leave us, basically?
Yes, like you mentioned, studies are still, these are preliminary results. They are not really telling us that they are not functioning. The vaccines are not working. And then, like we said, like in flus, there are usually the immunity wanes with time. So there might be need for booster doses if the what they call it, the epidemic the pandemic continues to wane, it continues to rage, because the most important thing is for everybody to be vaccinated, like I mentioned earlier, so that we will have what we call the herd immunity. For us to achieve herd immunity, the vaccine coverage must be improved and strengthened. Like currently, the federal government is saying all civil servants should be vaccinated, which is a very good move, so that it's not about, because people are coming to work. You have a responsibility. Your right stops where other people's right starts, because people need to be protected. Because there's no way somebody will come into work who is not vaccinated and endangering others. So there's need for massive vaccination, especially to middle group. And as I can see now, campaigns are being carried out by the National Primary Health Care Development Agency, not only in hospitals now, even in parks, in some towns, and then it's being scaled up to that state. So there's need for us to really monitor, and then there might be. But the problem, like I said, our own is not even booster dose, it's even getting people vaccinated, making sure that all the eligible persons get their complete doses. So that is when we now start discussing
what do you think is the challenge? Why we are not hitting the target of 40% herd immunity that the government had set earlier this year when it was receiving the vaccines?
No, the government was saying 40% coverage by December for all those eligible. So it's not 40% immunity. And then also, the vaccine is not even adequate, because I think we have almost not more than 15 million doses of the vaccine in country, and we're not manufacturing. And then countries that are providing these vaccines to are battling with they are battling to get their people first. So that's why we're saying We need to strengthen our what do you call it, the lab mechanism, the pharmaceutical companies, so that we can be producing these vaccines at home, so that we to cover our population. And then also the vaccine hesitancy rumors in the initial part, people were spreading rumors, stories that are not there. So, and then the fear of the unknown, which is normal in every society. So, but now we have been vaccinated and we are still doing fine. We had very few adverse events. So there's need for people to come out and get these vaccines, so that these vaccines would not expire on us, because these vaccines have a low shelf life. They also the storage mechanism. A lot of funds are being spent on the logistics of these vaccines, providing the cold chain mechanism, making sure that, and then even paying the staff. So there's need for people to come out and get this vaccine, so that at least we can reach a coverage of at least 10%, and that will also help us in taming this Omicron variant.
So far, it is reported that only 3% of eligible persons have been covered. And so if we're looking at 10 or 40%, we still have a long way to go. It means that there's still a lot of drive that the government has to put in to make people come take their vaccines. But then again, there is this concern about funding being a major challenge for especially molecular labs and all of it. Have we really shown the necessary leadership to really address and manage the COVID-19 as a country?
Sadly, we are still grappling with this. Really, we have not done well in our molecular labs. Even though now, as I can see, COVID, that's one of the gains of the pandemic. We now have molecular labs across the country, which will help in diagnosis and even getting these variants. In the past, we have to carry these samples to other countries to get this test done. So at least there's an improvement, but we need to do more in our vaccine, and we need to provide funding, which is a major cost of the matter, because funding is really we don't fund research. Our funding for research is very low, so there's need for us to provide a lot of funding for research. And then also, like I said, these vaccines are expensive, so it requires a lot of funding, like getting 80% of Nigerians, 80% of the eligible population, that's people that are eligible for the vaccine, to get the vaccine is a lot of money, a lot of resources. So we need to do more. Government needs to do more. Our private organization needs to do more. Our communities need to do more. So it's all of us. It's not only the government. It's our communities. We need to come out and get this vaccine, so that at least we will surmount this problem.
When you're saying that we need to do more, in what sense are you saying now? Are you saying that perhaps the government needs to look at partnership with some of these companies who are producing these vaccines, as we see, or as we saw India, do? Or are we looking at having a conversation with African countries where we can have something that is domesticated for Africa, where all the African countries can benefit?
I think we should look at the regional level of Africa, because as you can see, Africa is, if you look at the data, you can see the vaccine coverage in Africa is very low. So we need to have our own African homegrown system, whereby we will have the production, the distribution, and all other ancillary things that needs to be done, even at regional level, maybe West Africa, Central Africa, at different strategic places where we have countries that have the needed, not only the infrastructure, the human resources, the materials, so that we can have, we don't need to rely on other continents doing those things, because they are also battling with this pandemic. So they have to satisfy their home end before they can give to the outside. So we need to develop our own homegrown system, so that at least our coverage will improve. because I don't see any improvement without looking at this, our own African system, our own African research system. And this is a wake-up call for us in Africa. Not to be relying on our colonial masters and other countries outside our country, as you can see what India has done. So we need to think that way and have a homegrown system that can satisfy our teeming population. As you can see, India is almost 1 billion. Africa too, we're almost 1.something billion. So the numbers are the same, and then the size is the same, and we have the technology. But the only thing is we need funding, like I said. So there's need for that coordinated partnership between African countries, Francophone, English-speaking. Let's come together, look at how we can collaborate and form a formidable force so that we can be self-reliant, so that we don't need to rely on other countries to provide this for us.
All right. Dr. Usman Bashir, that's a fine place to leave the conversation. Thank you so much, public health physician Dr. Umar Bashir, for your time.
Thank you for having me.
Right.